So let me just begin by thanking Ashu for organizing this series of seminars. This is our third seminar on COVID in South Asia. And we're still working on the format, but so far these have been quite dynamic and informative, and the size of the community of participants has been growing. As I was saying earlier, some of you may not have heard this, but for now, this forum is exclusively for members of the Brown community, which allows us to allow you to all actually participate. So you can unmute and you can contribute to the conversation and ask questions live. And then when we're done, we'll do a little bit of editing and we will post this on our website, and it'll be available to a general public. So let me just begin by thanking our guests for being with us today. SM Vijayanand is someone I've had the good fortune to know for, I think, almost 30 years. As I'm sure most of you know, he's had a long and extremely distinguished career as an IAS officer, serving both at the center as Secretary for Panchayati Raj and Rural Development, but also most recently as the Chief Secretary in Kerala. And in addition to his work as a government official, he's also known as one of the key architects of democratic decentralization in Kerala, which started back in the 90s, and as I'm sure we'll hear from him today, has played an important role in Kerala's response to the COVID crisis. We're also very happy to welcome Deepa Sinha, who's an assistant professor at Ambedkar University in Delhi. She works on public health as an economist and has also been very active in the Right to Food campaign. And she's going to be commenting for us today on the case of Delhi. So both Delhi and Kerala are, hot spots. This is a virus, a pandemic that completely and totally parallels globalization, right? All the hotspots in the world, from Lombardy to New York to Seattle to Kerala to Delhi to Mumbai and now Gujarat as well, are some of the most globally integrated spaces in the world. And this is a virus that travels, and so it's hitting global hotspots, and two of them in India early on were Kerala, and now later in the process have been Delhi. So it's going to be interesting to hear about how these two states have each responded to the crisis, and no doubt we'll have occasion to talk about other states. But Ashu and I thought it was important to do something focusing on states, because as we're learning in the United States as well, it's really local governments that are dealing most directly with both the pandemic itself, trying to contain it, but also with the welfare impacts of the pandemic, which have been extremely pronounced in India, and again, with a lot of variation across states. So let me just once again thank our guests for being with us today. I'm going to ask Mr. Vijayanand to speak for a few minutes, 10 minutes or so, and tell us a little bit about the Kerala case. And we've all been reading in the media about how successful Kerala has been, but it's a complicated story, and there's many angles to it, and we look forward to hearing your analysis. And then we'll turn to Dr. Sinha and talk a little bit about Delhi and maybe some of the some other states and how they've responded to the pandemic and the welfare issues. And after these short presentations, we'll open the discussion up, and I really want to encourage everyone to participate as much as possible. So first of all, I just want to check in. Everyone can hear me? The audio's fine? We're good? Yeah. So Mr. Vijayanand, if you would, tell us about Kerala, please.
Thank you. I still recall the first meeting in 1991 when you were a young researcher doing work on Kerala labor.
Okay. Young is the key word there, yeah.
So, how Kerala differs, or Kerala was a pathfinder or an early actor. So these are the 3 points which I will cover. I don't know to go into all the aspects of Kerala's management. The most important thing is anticipation. Even before the first case was detected on 30th of January, in the middle of January, they formed a committee and started discussing, we are an open state, people will come in, how we should handle it. That was something rare in government. It's purely within government. And the Nipah experience, two bad Nipah experiences, but they were more geographically confined. They learned by doing, the health department, how to do the contact tracing, how to run around, how to protect, how to use all these equipments and things. So that gave them very good early advantage. Then the first case was detected, second, third, all the first cases in India. And because of the earlier experience, they had clear protocols on screening. Kerala started screening, I think, from the 1st of February in airports, thermal screening, and then contact tracing, as I said, and excellent surveillance. I mean, right at the field level, going to the household, movement of the people. So they are sometimes mapped and published. You visited this spot, you got into this auto, that kind of detailing they were able to do. And they had some kind of dynamic planning, situation changing every day, sometimes despair, sometimes hope, then sometimes in between. So today was 3 cases. Yesterday was 10, which scared us. And today we're little, and tomorrow we don't know. So the uncertainty still continues. Though we all claim that we have flattened the curve and are better off than we were. So we are planning for a kind of worst case scenario. So I understand, it's been publicly revealed by the Chief Minister, 1 lakh beds are ready should it arise. If there is an influx from the Gulf and we need to protect people. And at least 2.5 lakh places for quarantine is also ready. And this 1 lakh could be ramped up in extreme emergency to even 2 lakhs. So that kind of preparedness. Of course, on equipment, we are still scouting the market. We have some stock. I don't know the details, but it's comfortable as of now. And another important thing Kerala did was using local capacity for production of as many things as you can. Even the self-help groups of poor women started producing hand sanitizers and masks way back in March. So giving them a job, getting them involved right in the beginning. And they even, one of the engineering colleges came out with what they call a WISC, a screening kiosk, which doesn't export. It's a international best practices. And some R&D, even for plasma analysis, they have capacity. But a remarkable thing was, at the beginning of the onset, we had only 1 lab in whole of Kerala which could test this virus in Alleppey. Within 1 month, now there are 14 public labs and 2 private labs doing it. So this is a kind of a miracle. And they even set up a Kasaragod of the northernmost district of Kerala was a hotspot, is still a hotspot. And there we were able to set up a 400-bed COVID hospital in 4 or 5 days. So that is again a very important thing. Something which needs to be studied post-COVID. I hope this trend continues. The treatment skills of the doctors. All of them have been treated in different medical colleges of government only, and some even in upscale district hospitals. And so far, I'm saying touch wood, out of 450 cases till today, only 118 are in the hospital. And there have been only 3 deaths, including 1 unfortunate demise of a 4-year-old child today. So what exactly contributed to this personalized treatment? And always we orally attribute high degree of skills to government doctors. But this is not just skill or technique. This is just relating to a patient in extremely dangerous circumstances. I think this needs to be documented independently post-COVID. Then, of course, Kerala was the first to come out with a package, and a fairly broad package. And typical of Kerala, it aimed at putting some money into the hands of the poor for at least 1 or 2 months. All pensions, and we have a large number. Kerala has only about 8 million plus families. More than nearly 5 million people get assistance. 4.4 or 4.5 million people get assistance of pensions. It's about 1,300 rupees, 1,200 rupees a month. Then welfare funds were all activated. You personally know the number of welfare funds. They were all giving 1,000, 2,000 kind of benefit. The Kudumbashree women, which again covers about 4 million, they get a soft interest-free loan so that tide over the crisis. That gave a lot of confidence to them immediately, as even before this got rooted. Then government assured the effective PDS system, everybody will get 1 month's PDS, what they call ration in Kerala, free of cost, but plus added food kit. which will take care of the essential condiments. Rich, poor, everybody can avail of that. And then in every panchayat, a community kitchen was set up mainly for people who have no houses, people who have no PDS, extremely poor, destitutes, but more importantly, the migrants. So migrants is something which you need to know. All over the world, it's a sensitive topic. But Kerala, we were out migrants for a very, very long period in history and not at high-end jobs. So every Keralite knows what is the suffering which a migrant undergoes when he or she is doing an ordinary job, particularly in the Gulf. So that respect for a migrant is very much there. And it has been estimated there are 2.5 million migrants in Kerala and more or less equal number who have left Kerala for other things. So there is a feeling among the people that they should be respected, their suffering should be understood. It's almost natural. It's almost part of the societal culture. So government said, we will feed you. We want you to go back, we will help you to go back. But since the national government has taken a stand, we shouldn't move now. They are all put in camps. There are nearly 19,000 odd camps. So the way migrants were treated, also this thing, hotels and that camps. But most important, which I think is almost unique, every person in Kerala can contact, that's the local government comes, can contact the local government for any assistance. I have money, but I can't go out to buy medicine. Can you help? Volunteers go and do this. Food, I can buy food. I don't have food. I am hungry. I need all those things. There is somebody to take care of. So far, we have not heard many complaints that this has not happened. And this is an assurance coming from above. Of course, we follow a lockdown. And because everybody is scared, it's fairly strict. But there is a human element to it. Today, I was really pleasantly surprised. We learned that 500 cancer patients regularly get treatment in Trivandrum. And they are residents of Kanyakumari district, which is in Tamil Nadu. And inter-district travel is not allowed now. And so, Kerala government has tied up with, it's a very heartwarming interstate cooperation with the Tamil Nadu government that we will open an outreach center in Nagarkoil, the district headquarters, and the doctors of the cancer center of Kerala, which is one of the best in South India, will go and treat them there. So these kind of things are encouraging. So it's not a very harsh lockdown. It's harsh in the sense you can't move out. But all your things are, including psychological needs, are taken care of. Somebody talks to you, somebody looks after you. And at one point of time, a policeman, a senior police officer, took it to her very seriously, and some violators were asked to catch their thing and go book, which is a typical punishment. It used to be a punishment in India. That day, the chief minister publicly admonished him and said, this is not acceptable in Kerala, we will not repeat it. And he's the police minister. And another touching thing, government itself filed an affidavit in the court saying that we have to cull stray dogs because they are dangerous to human life. Now, the government issued instructions, feed stray dogs because they will not get food. So these are some of the elements which are relevant. But more important, probably the most important feature of Kerala's thing is the communication at all levels. But most important is the daily communication, which you must have heard of. The chief minister does almost a 45 to 1 hour communication. It's not a typical communication of a political. It may look deadpan, but it is all information. Nothing is hidden. How many dead, how many in hospital, how many discharged, all challenges, and what we are trying to do. And even needs of small groups. Suddenly somebody said, those who are making pots, maybe a few thousand in Kerala, they are hungry. He said, I got a thing there, so they will be given food tomorrow. Somebody is not able to go and buy something, a repair. So that will be opened on one day. So every problem is listed, and government says, this is what we can do, this is what we cannot do. So it's that kind of assurance is there. And the risks are highlighted, the positives are there, and accolades and tributes. So today, even a hard double-dyed bureaucrat like me became very sentimental when he said that a destitute has given her monthly pension for COVID's costs. And it's not one or two. All these are highlighted. So it is this mixture, nothing emotional, nothing propagandist, but clear-headed communication. Probably this must be the most watched TV program ever in the history. So that is something which is working wonders. And coordination part is well done. Typical, I don't want to get into it. The most important point I wanted, how they could do it. As you know, primary health has been given importance even before independence. But post-independence, it got more, and particularly in the last 10-15 years, it tend to decline with the rest of India post-liberalization. But last 10-15 years, public institutions, especially hospitals and schools, have been improved. So much so people are, the reverse voting with the feet. People are coming back to public institutions, and numbers are there. I'm told in schools, nearly 500,000 children have come back from private to government schools. So this improving public service delivery has been an agenda to which the biggest contribution is the local governments, particularly the village panchayats, municipalities. It's their school, it's with them. So primary education and all education up to secondary has been transferred to different local governments with powers of control over staff and money for local planning. So this is something which worked wonders. We didn't anticipate it when we started it with a lot of expectations that this level would be achieved, and it was not achieved in the first 4-5 years. So we are worried, but over 10-15 years, this has been achieved. The quality of service delivery and how the nature of the state is changing. People's plan, participation, response to development needs, providing minimum needs, moving on to self-help groups. And that is a very, very important point which the whole country has to take note. Kerala is the only place where self-help groups work in partnership with the local as equal partners. I even describe it as social capital and political capital, social democracy and political democracy. So next time you come, you should look into it from a theoretical perspective. Political democracy, social the dynamics of interaction, who helps. Initially, there were a lot of fears, politicalization of the women and women doing parallel power centers. No, it has been a cooperative, synergetic, mutually beneficial relationship so far. It is this partnership which gives a community character to the local. Unfortunately, our village assemblies, people don't come. But this is a very dynamic kind of thing. There's a demand factor, and all kinds of things is there. And another is a step-by-step change of the Kerala model or transformation of the Kerala model, addition to the Kerala model. With People's Plan, 2-3 years, we started the gender plan. So gender sensitization, understanding gender needs. And in last 10 years, that is something which needs to be noted. What I call the programs of care and compassion. There is no electoral calculus. You will not get votes. The palliative care of people who have nothing more. And that Kerala is one of the international best practices. Now, care of the elderly and differently able. All these have become local government responsibilities, and they are doing fairly well. So decentralization has brought in this element of care. It's not a nanny state, it's a caring state. So that difference is something which I wanted to note. And when Flex came, that was again unforeseen, unexpected spin-off. When the Flex hit Kerala in 2018 and 19, without disaster management is not a devolved subject. It is with the government. But the first responders were the elected members, not officials of the local government. They just went to the field, and in rescue and relief, they played the lead, and that stood them in good thing. Then they went to this massive disaster. So they could reach out, and they are still in the lead. So the transformation of the welfare state to a caring state and social democracy and political democracy, linking and maturation of local governments. See, local governments act within a functional domain, within a framework of devolved functions. But now we find local governments are trusted to do functions which is not devolved. Government themselves trusting without anybody asking. So now they are supervising public distribution system. They are even looking where there is some hoarding or cheating or overcharging. These kind of things are not given to local governments. They have been given a role. And most importantly, that's my last point, the link with the people. Help is close by, near at hand. That is a trust which reduces anxiety in this kind of things. And here, Kerala's contribution has been. Thank you. Thank you for giving
Thank you.
me this opportunity.
Thank you very much. That was wonderful. Before we move on to Dr. Sina, I just want to set aside a few minutes to ask some immediate questions in response to Mr. Vijayanand's presentation. Is there anyone who'd like to ask a clarifying question or ask for expanding on some of the wonderful points that were made about the role of local government? And I especially liked your point about the transition from a welfare state to a caring state, and how that degree of institutional presence invites greater trust from people, because it strikes me that the biggest challenge of this pandemic is eliciting compliance from citizens, right? I mean, most people cherish their liberties and the right to move around freely. And for a democratic government to ask people to hunker at home and lock down for a month is an extraordinary demand. And it seems that Kerala's had a very high degree of compliance, which in and of itself is something that deserves to be explained. Does anyone have specific? Yeah.
One point to be noted for the audience is that Kerala's local governments are political, and Kerala is known for its adversarial politics. But at the local government, I think nearly 40% of the local governments are with the opposition. But in this, you don't see party. That is an unexpected thing in Kerala.
Yeah. And it's all the more striking because Kerala has a history of extremely competitive, highly mobilized, you know, at times quite polarized and very ideological politics. And yet this seems to be a fairly apolitical moment where both sides of the political spectrum have cooperated. And, you know, I can't but help draw the comparison with the US, where, you know, the divides are, if anything, getting deeper and deeper as we try to manage this crisis. We'll have lots of time for questions afterwards, but are there any immediate questions before we move on to the case of Delhi? Ani, I saw you raised your hand.
Yes, I guess this still works virtually. Yeah. Hello, Mr. Vijayanand. I had a quick question with reference to today's speech by Modi, where he directly interacted with panchayats across the country, and sort of what you felt, what you thought the messages were and what they should have been, especially because I think the bigger takeaway was self-care rather than the caring state. So, so sort of how does that contrast with your idea of the welfare state, at least, you know, in comparison to the Kerala model, which is diametrically in contrast to what, you know, is being proposed from the center. So,
I was Secretary Panchayat Raj in Delhi. This discourse on local governance is not there. One of the reforms we have forgotten in India at a macro level since '91 is governance reform, and a critical part is the last link. So that is a tragedy of India's governance reform. Nobody speaks of local governance. They think Panchayat is an agent. When government asks you to do, they will do this. But for them, what I call soft devolution. Soft devolution means you trust a panchayat as a local government. Give it the respect which a collector gets, and then they perform. So the soft devolution is the key for local governments performing. I didn't listen to the entire speech. I got it from the news only, but it was just exhorting them that you have a big role to play in the current thing, but not saying that this is your functional domain. And primary health is not mentioned. And primary health has got a lot of social determinants which can be delivered only by a local, not by anybody else. It's not ideology, it's a fact of governance.
Ashu, you had a question?
Yes. The discourse, popular political discourse, got very communalized in much of India after the Tablighi Jamaat incident. Can you tell us how Kerala dealt with it? I have worked on Hindu-Muslim questions for a long time, and I studied Calicut at length, and then Kochi a little later. But can you tell us how, I know that communal virus doesn't go very far in Kerala in general, but but were there returnees from Tablighi Jamaat in the state of Kerala after that meeting? And
Yes,
how
yes.
was the Tablighi incident or the larger communal question handled in the state?
First, by some accident, most of the media called the top Muslim leaders on the day of the incident and had what they call this discussions in the channel, different channels. And most of the Muslim leaders acted, I saw one or two, with great maturity. They said it is wrong, but it is not because they are Muslim they did it. It is wrong. We don't agree with it. There is nothing religious about it. Just foolishness on the part of the people not to have understood this, and nothing deliberate. So that came in the media as a discussion. Interestingly, the chief minister in his daily remark said this is just an health incident and it is not a communal incident. And he said, I will not allow anybody to use it. But at the same time, Kerala managed to track every one of them. And the last person, the CM came, the government formally said, we have tracked everyone. And that was something they did. And since they tracked them early, they didn't get into a problem like our neighboring state, where most of them were returnees from the Tablighi which spread disease. So because they didn't spread disease and they were tracked, and at worst it was mentioned as a foolish act and it can't be linked to any religion or any group. And then there were a lot of write-ups about Tablighi. They're apolitical, they may have very fundamental views, but they are not in that sense a negative group. They look inwards, they look at religious morality and all that. So all this together, the political message, the views of the Muslim leaders, and exposition of what is Tablighi. And Kerala newspaper readership is very high. It never, even among the hardcore people in this thing, it was never taken up. Though I understand at the national level, after Tablighi, again, the communal virus has started floating around.
Can I ask a follow-up question, Patrick?
Yes.
Sure, but then we do want to move on to our next case. Yes.
Then we go on to Deepa. Mr. Vijayanand, you just mentioned that your neighbor could not handle it as well, and that's Tamil Nadu in particular. I think that's what you had in mind.
Yes.
And is it, let me put it this way, is it that the great infrastructure that already, public health infrastructure that already existed in Kerala allowed contact tracing effectively, and Tamil Nadu lacked that, though even though Tamil Nadu today has the impression, at least all over the country, and Deepa, who's a public health specialist, public health economist, she can tell us more, that it has a fairly elaborate and developed public health system now, perhaps second only to Kerala, or maybe, perhaps second only to Kerala. Now, was the contact tracing capacity, according to you, did not exist there, which existed in Kerala, or the problem is much more political?
No, there's no politics in the whole thing. One is sheer numbers. We had a 100 or 150 kind of thing. I forget the numbers. Tamil Nadu had more than 1,000. So they were swamped by the numbers. That's one valid reason. And Tamil Nadu's primary healthcare system is, in a sense, better than Kerala in the curative sense. Kerala, they don't focus on cure. People go to higher hospitals. But in Tamil Nadu, a lot of people go to the PHC and is rated as one of the best. And many people say it is second only to Kerala. And it has caught on in the last 20, 30 years. So there was a lot of progress, a lot of presence. But this social kind of involvement, the panchayat, people going around, and words spreading around that this is very dangerous. And anybody, initially even in Kerala, some people tried to hide. The second wave were people from Italy who didn't disclose, they were scared. But now everybody reports, yes, I have come from Tamil Nadu. What should I do? So that kind of communication existed in Kerala. It didn't at that point of time in Tamil Nadu. Now Tamil Nadu has also caught on with this kind of, I read Tamil papers also. I'm a Tamil speaking Keralite. So I read Tamil papers every day. And now I find the change is coming.
Thank you.
Thank you. Dr. Sinha, let's move on to the case of Delhi and comments you might have about other cases.
Yeah, thank you, and good to see some old friends, Arushi, Kalayani. So thanks for giving this opportunity. Sadly, I mean, as I was listening to Mr. Vijayanand, once again was hoping that we were all Kerala citizens and did not have to deal with the states that we are dealing with currently. Mr. Vijayanand, actually, I had met you like more than 20 years back when I'd come with a students group to study the People's Plan in Kerala. And yeah, we are nowhere close to something like that, I think, anywhere else in the country. And Delhi, of course, also is unique in many ways, being the capital city. It is a city state. The governance system is also very different because we have parts which come directly under the central government. Then there are parts which come under the state government, and there are things which come under the municipality. And normally there is, even in normal times, we find that the coordination between these three, and often it's not the same party which is in the majority in all three. And therefore there is a lot of chaos in regular public service delivery that happens in Delhi. Mr. Vijayanand, also one of the things which definitely was lacking in Delhi was this whole issue of being the preparedness starting early. Delhi, we must also remember the context the whole city was in the last 4 months. It almost now feels like another era. But from about September, October onwards, we've been seeing student protests on fees, followed by protests against the Citizenship Amendment Act, and a lot of police repression. And then finally, towards end of February, what we saw were these were riots, and in fact, pre-planned kind of pogrom where a large number of Muslims were hurt, property destroyed, and so on. And therefore, when this disease came in, it was already in a situation where the city is highly polarized, and polarized, of course, Hindu-Muslim, but also I think because there is this whole for instance, the whole urban Naxal, JNU students fighting against the fee right. There are all kinds of imagined enemies in the city, and therefore this whole kind of caring society that Mr. Vijayanand talks about, and which I think is very important in this kind of a context, in the current context, to make anything work, was completely absent in Delhi. We must also remember that Delhi, even otherwise, is not a very friendly city, particularly for the poor. There is, those of us who've lived in Delhi would definitely know that Delhi, on one hand, everyone almost who lives in Delhi is a migrant. None of us belong to this city. Nobody feels like they belong here. On the other hand, the city runs because there are people who come from all over, and there is a lot of suspicion with which the poor are looked at always. So for instance, there's always this thing of the Bangladeshi illegal immigrant, where people have domestic workers in their house coming in and working, and at the same time suspect them to be Bangladeshi immigrants, and so on and so forth. We also have the situation where, because Delhi is surrounded by extremely poor states, particularly on the east, Uttar Pradesh and Bihar and Jharkhand, and even northern Madhya Pradesh, that the migrants coming into Delhi are extremely poor and very vulnerable. And the state government, or the present AAP government, even the previous Congress government, has always had a very not a happy relationship with the migrants. We've often had various chief ministers make statements like, why should our money be spent on Biharis or on people from Uttar Pradesh? People come here because their states are doing so badly. We have good health facilities. Even when we demand for better food programs or so on, the response often would be that if we improve all this so much and make it available so easily accessible for everyone, we'll have more and more migrants coming in, and that's something that we don't want. So overall, although there is a large proportion of migrants in the city, particularly poor migrants living in very vulnerable conditions, the attitude of the city, both the state and the elite, has been something which is where one would like to invisibilize them and like use their services, but not see them otherwise. It is in that kind of a context that the COVID, I think we have to look at the COVID crisis and the response to it. And therefore, without being prepared early, till mid-March, there were big meetings going on in the city, there were protests going on, there was all kinds of things going on. One of the first things that the Delhi government did do, which was also one of the states, I think, first states to do it in the country, was to close down schools and malls and cinema theaters and so on. That was something that was done on the 3rd of March. But even in terms of screening in airports, who all got screened was something that only slowly began to be expanded for a very long time, although our Prime Minister said something otherwise in his previous speech. But for a long time, it was only those who came from the high-risk countries who were screened. And so that was also a problem initially. And today we have, according to the Health Ministry's website, today there are almost 2,400 cases in the city and 50 people have died. In contrast to, again, what Mr. Vijayanand was talking about in Kerala, about much fewer people dying. We've had already 50 deaths, which proportionally also is much more, or even though our number of cases are higher. So the response of the Delhi government was a bit slow. But at the same time, when I look at what's happening, say, in UP or Bihar, we feel Delhi is still better. But when we look at Kerala, we feel like we are nowhere close to having given a response. But one of the first responses of the state government, and currently more than the COVID infection itself, what is the bigger problem that most civil society is grappling with in the city is the hunger and the distress caused by the national lockdown. So we had different kinds of distress happening. One which was largely covered in the media was these huge thousands of migrant workers who were not prepared at all. There was a national lockdown announced with a 4-hour warning. And probably the state chief minister did not even know that that's how it was going to happen. And so we saw this mass kind of exodus of people trying to get back to wherever they come from. And with all public transport closed, the borders were not immediately closed. The first few days, it was they could walk across the borders. So you saw thousands and thousands of people with families, old people, young children, trying to walk across hundreds of kilometers going back. And this was clearly coming out of what I was saying earlier. One, Delhi not really being a friendly city and people not feeling that it was their home. And therefore, once they could not work, they knew that they were not needed there and nobody felt comfortable staying there. There was also a lot of information gaps where people are also really scared, and that one sees still continues, scared for their lives, where they think that this Mahamari, this disease is something which will kill them, and they want to be with their families if something so terrible happens. So we had, on the one side, the migrant crisis of people trying to go back, and nobody was really communicating with them and telling them or reassuring them that they would be taken care of. The immediate response in the first week in Delhi was basically to set up these feeding centers, which was also kind of possible here because over the last few years, as a response to a lot of litigation in the High Court and the Supreme Court, there have been many homeless night shelters that have been set up in the city. And that is something that the Aam Aadmi Party government was also kind of focused on. So because there was this infrastructure of the night shelters, and most of the night shelters are run in partnership with NGOs, one of the first things they did was to say that cooked food would be available in these centers 2 times a day. But almost from the next day, we saw that the queues in these centers sometimes went up to 4 kilometers. And people had to queue all day. And finally, when they reached, they probably did not even find the food. So it is a food crisis that continuously is something that the government is trying to respond to, but is always falling short because they're not able to anticipate the kind of demand there is, despite, again, a lot of civil society pressure and people telling them that this is not enough. So they then expanded the cooked food availability from night shelters to over 300 schools across the city providing cooked food twice a day where anybody could go and eat. But here again, we found that the last mile was not thought of. So if there was a group of 20 migrant workers who were, say, a kilometer away from the nearest feeding center, then if the 20 of them tried walking to the feeding center, they would be beaten up by the police on the way. And then they would have to try and contact somebody to say, we are just going to eat and you have to let us go, or send us food where we are. And this is something we continue to hear even now, where this entire lockdown is being done not out of the compliance is not something entirely voluntary, but it is basically the police state which is making it happen. And it's not as if people are not complying or do not want to comply because they don't agree or they want to go against the state, but it's oftentimes people are getting out for basic necessities, to reach a health center, to buy food, or to try and find food. And that is a problem that continues to remain here, that there is a lot of fear in trying to go out. And at the same time, the services have not reached the last mile. So the other issue was again related to food, the whole issue of the public distribution system reaching everybody. So Delhi, currently the National Food Security Act, about 40% of Delhi's population has a ration card, and the state government, even before the central government said that they would give them free rations, and they normally get 5 kilos per head, and the state government said that they would give 7.5 kilos of grains per head. It took a while, but by the first week of April, most ration shops were open and there was distribution happening, even though there were a few leakages. But what we found was the bigger problem was those who did not have a ration card, which once again also relates to this whole issue of many people being migrants, have not been living in Delhi for a very long time. And even there, the response, so in a few days again, once again, it's probably one of the first states in the country where the chief minister said that they would give rations to people even if they did not have a ration card, which I think was really needed at that point of time. But that's where this whole issue, I think Mr. Vijayanand put it very nicely, the whole issue of social democracy and political democracy and involvement of the community. And I think trust between the state and the people. Although they said that they would give rations to those who didn't have ration card, it was not a simple system where you could say, I am hungry, I need rations. It was a system where there was this online portal, and that's the system that's continuing even now. There is an online portal that has been created, and a hungry person or a person who thinks they need these free rations and not able to get any other food has to fill in an online application, upload their Aadhaar card, upload their family photo, get an SMS, which will have a link to an e-coupon, and then they have to go with their smartphone to a nearby school, show the e-coupon, and that's when they get their grades. Now that's an extremely cumbersome process. Most of people don't even have smart cards, and it is not even something that's very easy to do. As volunteers, we tried filling that for people, and even we got stuck because the net would go down or the SMS wouldn't come, various things would happen. Despite all this, and this is where they did try to help, in the sense that they said that the Aam Aadmi Party volunteers and the MLAs would all help people in filling the forms. The government recently, the chief minister in a press conference said that they ended up getting over 30 lakh applications, 3 million applications for these 3 million people who needed, saying they needed free rations, despite the site being down for about 4 days, 2 days after it was put up. And they, according to official figures again, have been able to give around 3.5 lakh, 350,000 people rations so far. So although there is some response when issues are brought to the attention of the government, the chief minister does a press conference, or they're very good at social media and Twitter management. They do say that we'll take care of this, and they announce something. For it to actually reach the ground and reach people, the systems that are putting in place are not very easy. And even after those systems, people try and deal with it, it takes a very long time for people to actually get it. And currently, the situation is so dire that we cannot afford these kind of delays. And that at the same time, one understands that it is like this because governance here was never very great. It's not as if we had this system of communication down from the frontline worker up to the secretary at the state or anything. And we see the problems that we are facing currently because we don't have that kind of a governance mechanism in place. And in the absence of that, all the time, there are more and more conditions that are imposed on the people, on the beneficiaries, to ensure that there is no leakage. So Aadhaar becomes compulsory, photographs, various things, which in the current situation, even otherwise there are problems, but currently it only ends up excluding people more and more. So just to conclude with 2 or 3 points, I didn't talk very much about the response in the health sector. In fact, as of now, we are not hearing so much about COVID positive people not finding beds or any such thing. But there is a huge concern that, for instance, the Aam Aadmi Party had started a very good program called Mohalla Clinics, where they were running these clinics in local communities, that many of them have been shut down. The big hospitals like the All India Institute of Medical Sciences, which gets patients from across the country, that patients are stranded outside the hospital and it's not functioning full capacity to non-COVID patients. There are reports of home deliveries taking place in Delhi now again, because women and families are just too scared to go to a hospital. They're both scared about contracting the infection in the hospital, but they're also scared about the traveling the distance and facing police harassment while going and coming and so on. So we don't know what other kind of health emergencies are happening and how people are struggling in relation to that. The whole issue of contact tracing, which seems to be one of the most important things to do, is definitely not happening in that kind of efficiency that the Kerala model is. Of course, there are many, many more cases, and it's a difficult city and we don't have decentralized governance systems, but that does not exist. But so overall, what we find is that there is a state which is kind of responding to emergencies. Like if you tell them that the people are starving and they may die, they will send something there. They've formed something called a hunger committee, which has 3 civil society members, which is kind of an interface through which we are able to communicate with the government. But this kind of society level solidarity is still sort of missing. And you do see the differences, for instance, in the better colonies, the gated colonies, the resident welfare associations, the RWAs have become like the new Nazis. They create their own rules. They don't let people come in. They are having discussions in their WhatsApp where there are some people saying that we will not pay our drivers, our domestic workers, because they're anyway not working. So there is all of that happening on the one side. And in response to that, all that the government has done so far is to keep just issuing these advisories saying, don't stop paying wages, don't demand for rent and so on. But nobody knows what will happen if they are forced to pay rent or if they are not getting wages. There is no clear, easy system where you can go and complain or you will get some kind of a redressal. So this complete absence of social solidarity is something that is quite troubling. Although I must say there is a small group, in the sense that when you put out an SOS and say people are hungry and you need funds, you're very easily able to raise it. But just in terms of day-to-day interactions, it is not a very kind place to be in currently. Since I've taken too much time, I won't say anything about other states, just to say that the neighboring states seem to be worse than Delhi in some ways. But of course, Delhi, because the burden is higher, also there is a kind of a tension, and maybe that's why the government is nervous. And therefore, and right now they seem to be thinking that the lockdown is the only way to prevent spread. I'll end there. Thank you.
Thank you, Dr. Sinha. I really like the contrast you drew between the police state and the caring state and the comments about solidarity. It's absolutely fascinating. I want to open this up to anyone. So if you have a question, just raise your hand, chime in, make sure you unmute yourself if you're ready to ask a question. Ashu?
Yes, Dr. Sinha, thank you very much for this very remarkable overview of Delhi. I have a larger question, which I think certainly applies to Delhi, but Kerala is a contrast, so perhaps Mr. Vijay Anand can also comment on that, especially given that he served in Delhi, not only in Kerala state. So we know for sure as students of agrarian political economy in India that India has an excess of food stocks in FCI godowns. Indeed, when I was last working on this problem, 3 to 4 million tons of food was rotting every year because there wasn't enough storage. Now, the whole argument about why you would have these stocks is that you could use them when either the supply fell short, food supply declined and prices went up, or when you had some kind of emergency and food supplies were necessary to alleviate the problem. Now, when you say that those who had ration cards could get food and those who didn't couldn't, and there were, I think your account of what all they had to fill out in order to be noted by the state itself was very, very insightful, I thought. 3 million registered and only 3 lakhs or 3.5 lakhs got food. Now, in a situation like this, releasing FCI stocks of food grain would be a stock response of a government. Why do you think something like that? There were some op-eds written on that, but why do you think we didn't hear a larger government discourse about releasing grain from these stocks? What to alleviate the problem of hunger, which was bound to emerge after the lockdown. So if you can say something, and perhaps Mr. Vijay Anand, given his experience both at the state level and in Delhi, can also say something. So Dr. Mehta, what do you think?
As an outsider, what you're saying is absolutely true. And in fact, current food grain stocks are at a record high. India has been wasting food grain stocks for a long time, but currently when the lockdown began, there was 78 million tons of food grains in the FCI godowns, plus an anticipated additional 35 to 40 million tons of procurement from the Rabi harvest, which is currently going on and has been completed in some states. So one would think that, and the Prime Minister also in his speech where he extended the lockdown made a mention that we have the food and the resources, it's not a problem, we'll deal with this. But they've not been very generous with actually the distribution mechanism. One reason one can think of why, which is something that Jean also wrote about in one of his op-ed pieces, is just the finances of it, that they still, despite the crisis, despite the economic slowdown, seem to be very concerned about their fiscal deficit targets. And once this stock is released, then it becomes subsidy. As long as it is staying as stock, it does not show in the government account books as being subsidy, but it shows in the FCI accounts as being losses, and therefore does not make any difference to the fiscal deficit. I think this part holds true to a large extent, because what they did after a lot of pressure is to say that the stocks would be available for state governments or NGOs if they wanted. They didn't have to go through an online tender, but they've not made it available at the PDS prices or for free, but they've rather said that they would give it to states at 21 rupees rice and 22 rupees wheat. But currently state government finances are very badly hit because state governments get very few they have very few sources of raising taxes. The GST shares have not been given and so on. And one would have hoped that the central government just said that we'll give it for free and you take it. And that is something that has not happened. Second, as the campaign where we have dealt with governments at various levels, not just through the crisis, but even earlier, when there's been drought, for instance, in places, one constant worry seems to be that if we start something as a crisis response, it will be something that we'll not be able to withdraw after the crisis is over. So if we say give temporary ration cards, or if we open up our ration shops to people who don't have cards, then after 2 months, they'll still keep coming and saying, give us rations. And that is something that they don't want to get into. So I would think these are kind of the two reasons why they're doing that. Whereas, but it's really doesn't make any sense otherwise to have so many grains and have them rotting and have people hungry and not give them. I mean, at one level, I don't get it.
Yeah, these are very important points relevant to that. To add to that, I never saw the feeling expressed by anybody that there are so many crores of people here who we know that they do not have ration cards. We need to feed them for 2 months, 3 months. If that has come, the other things can be worked out very easily. For example, in one of the e-groups in which I tried to give some ideas, Ashmander leads that. Dr. Prabhat Patnaik indelible ink on a person's finger. Like that you can do for 20 weeks. So, and you don't need anything. And say you will not get it after that. That kind of thing can easily be taken, but I don't know why it was not taken. So I don't find, so the bureaucratic kind of insistence on procedures, you need a card, you need a Aadhaar, you need all that. At this point of time, with a simple old technique, you could have addressed that. And then another important thing, the National Food Security Act, which is brought out by Jean Drèze very well with figures, says 50% in urban areas and 75% in rural areas. And this is on the current population at a point of time, but it has been interpreted as 2011 census. So that is also adding to this.
Oh, okay. I'm reading Patrick's lips because he's muted. So I think he's calling out to me. Okay. Yeah, so I had a question for Deepa, which was actually to both the speakers, that like when we're talking about financing these bigger relief measures, like the question that is being popped up in mainstream media debates is that whatever the government is giving right now seems to be enough, and they can't give more because our fiscal position is just was terrible before and it will only get worsened. And all this talk about the aid to GDP ratio of the central government being very low in comparison to other countries is also being dismissed as saying that, well, Germany is in a better financial condition to give out so much aid as a percentage of their GDP, while India is not. So I'm just kind of wondering, what are your thoughts on the ways in which a better finance package would possibly be financed?
So firstly, I think that this kind of concern with the fiscal deficit at the current time is completely unwarranted. In fact, India already required the state to spend more. We were going through an economic slowdown, rural wages were stagnant, unemployment was at its highest. At this context, the state needs to provide the stimulus. It needs to spend more. And there is no way it can justify not spending more. So even the package that it has announced of 1.5 lakh crores, which is less than 1% of the GDP, part of that also is front loading expenditures which they had already planned, right? So, and compare that with Kerala, a state government which does not have so many revenue raising opportunities, announcing a 20,000 crore package almost immediately, one of the first states to do it. And for our health system preparedness, the central government for the entire country announces 15,000 crores. Yeah, less than Kerala's package for their state. And that 15,000 crores, after a week, they bring out a release which says is over the next 4 years. Not all of it is to even be spent in the next 3 months. Only around 7,000 crores is for the immediate spending. And the rest is something, so I don't know why they're using a COVID health preparedness fund where 50% of it is being spent 2 years after COVID starts. So clearly somewhere the thing of just not caring and holding your purse string so tightly, I just, again, you're trying to probably respond to finance and you're scared of inflation or stock markets falling and so on. But right now they've all fallen anyway. What we need to think about is restoring people's livelihoods, restoring the economy, and none of this is possible with the government being so concerned about the fiscal deficit. If they want to do it, I think it's possible. They can do much, much more than what they're presently doing.
Yeah. Today I read in the papers a very important decision in the right direction by Government of India. We will stop all arms purchases for the year and even stop the contracts which have not been fully executed. So, and they all said and done, we all talk of need for capital expenditure. Capital expenditure can be postponed by 1 or 2 years without really shaking the system, because all over the world there is a thing except for wages and all that. So some kind of capital expenditure which is not labor intensive can be postponed. Then this 3%, everybody is searching where it came from. I'm told it has no empirical basis. So some of your economic students should know that. So that is again a kind of a unnecessary fetish we are all tied with. Then what US calls at the last resort is quantitative easing. Some printing of the notes, well controlled and watching inflation should also be required. So, I mean, if you raise this 3 to 5 for 1 year, nothing is going to happen. And that will bring in a lot of money.
Kalai, you had a question? You have to unmute.
Thank you, Mr. Vijay Anand. It's a great presentation. I have two specific questions. Actually, this is something that I also began with after your presentation. Can you hear me? Yeah.
Yeah. Hear you.
So the first question is something you mentioned about the southern state, including Tamil Nadu. There is a concern which is some state has underperformed given its state capacity. State capacity, I mean here the health capacity, given the doctors per population, beds per population, primary health care. Given the capacity, there seems to be a concern the state leadership, the political leadership or the executive leadership have underperformed given its capacity, particularly in the context of Tamil Nadu. That is one seems to be. So given your experience, that sort of pattern emerges across states where the states are equipped better but delivered lesser as compared to what it has? This is first question one. The question two is that you mentioned, I mean, of course, we are talking about the 20,000 crore package the Kerala did. So there is some also concern of the center some ways not helping the state. Even the 20 crore the state Kerala announced is something has to borrow at the higher rate of interest where the center intervention is there. So even this has also been witnessed in the context of Tamil Nadu, where the delay for doing performance is basically because the center tied the state's hand. So there is a sort of center-state relation. So how much this both explanatory variable be possible explain what is, see, we see the variation across states in India.
Okay, we take specifically Tamil Nadu. It was not underperformance per se. It was a late start. And in a sense, yeah, it was late start. They got off very late. And you can't catch up that easily. Probably now they are catching up. You see their progress in the last 5-6 days. It's quite encouraging. So that is a late start and not being seriously understanding this problem. That is a very, very important thing. That's why I put it as the first point, anticipation, because nobody had any experience. Second is little confidence in our system. We are one of the best, so we can handle any crisis. So that overconfidence plus late start had this problem. By and large, I think southern states have done well. Odisha seems to have done well. But what is a little scary is Maharashtra, because of Mumbai and its slum population. Not for capacity issues, but the whole thing. Gujarat is a little surprising. It seems to be slipping as per the latest figures. The second point is very important. Okay, state capacity also, a critical factor that Tamil Nadu is doing well, southern states are doing well, is a primary health system. India suddenly moved into the insurance mode. The Ayushman Bharat, where everybody will go for insurance, which is only for curative treatment. So, if you get COVID, you can get the insurance. But the whole preventive thing is something which is the most important. So that probably would be the biggest lesson for the whole country, perhaps the whole world, from the COVID. We need a robust primary health system, as was envisaged about 70-80 years back. That concept of primary health. Second, yes, states are tied with the Indian constitution that doesn't allow states to borrow beyond a limit fixed by government. So states have been pleading instead of is to raise by some 10-20% your borrowing savings, or at least you have an annual borrowing saving, crash it and bring it to the first 6 months. But government has not so far agreed. It's very difficult to believe in this extreme situation, this fiscal consequence.
Banu, you had your hand up?
I have a question for Vijayanji. The question is that so what are the tasks which are being centralized, and what are the tasks that have been decentralized in Kerala? Just to sort of understand whether the corporations or panchayat, what are the tasks that the panchayats and corporations are doing, and what task has been taken up by public health or the state government. And if I don't know if Deepa has been looking at other North Indian states, whether that has happened in what is being decentralized and what is being centralized. The second question is a takeoff from what Kalai had just mentioned. So Kalai and I were talking yesterday, and we were looking at district-wise numbers of cases for different states, and it seems like Kerala and Maharashtra and Gujarat are states where COVID cases are restricted majoritarily to just 2 or 3 districts, whereas there are other states like Tamil Nadu, Madhya Pradesh, and Rajasthan where the COVID cases are more distributed across districts. So, given the comparisons that Vijayananji is making between Tamil Nadu and Kerala, you think that it is really not about, I mean, I would disagree that this is about the timing. I would rather think that this was about the political leadership, as Kalai has argued, or Kalai was making the point. Thank you.
Yeah, of course, there was a kind of political leadership issue also, but I know Tamil Nadu functions quite effectively bureaucratically. Even without political thing, with general ideation, they have the capacity. In a sense, I've seen from Delhi, it's one of the most efficient states in a bureaucratic sense. So that apart, this distribution, skewed distribution in Kerala is just because all the people from the Gulf, just before the embargo, they all landed, and most of them in the Calicut airport and Bangalore airport. Just a chance. They were all coming back for holidays. And they brought the largest number. And the way the Kasaragod district tackled it, Kannur is now tackling. That is also a lesson, object lesson. Bit harsh, but with all the elements of care built in. They called it triple lockdown. You can't come out of the house. But they deliver everything to you, medicine, everything. Subject, provided you adhere to that. So even they had a good, compassionate model. So that is the reason for this interstate kind of thing. I think I've answered both the questions.
Any? Ashu? Oh, Ashu, you have to unmute.
Yeah, if there are no others trying to ask, because I've already spoken twice. All right. At least from this distance, reading the press reports and also connecting with a lot of people in India, the impression that emerged was that Rajasthan state was not doing badly. That Rajasthan had, it is a northern state, and northern states are not known for the kind of welfare capacity that southern states on the whole have. I'm not sure about Telangana, incidentally, but in the south, but certainly southern states in general have greater capacity to deliver public services. That's, I think, a fair statement in India's for India's political economy or state variations. But Rajasthan, the impression that I gained was doing quite well, and especially how it dealt with Bhilwara was widely noted. So that's one question I have for Dr. Mehta, Dr. Sinha, and then the second one is, I've been getting reports from UP the arrangement of, after the first exodus began from Delhi, the arrangement of a large number of buses from Noida and or Agra to take migrants to their villages, quarantine them in schools, village schools, and then provide every panchayat 60,000, not a large number, not large amount, 6,000 rupees for food, and mobilize the village for provision of cooked food for the migrants for the 14 days of quarantine. Is there any, do you find this kind of reporting, which is not right now, not in the national newspapers, this kind of reporting that I'm getting from Lucknow and Sultanpur and Pratapgarh, is there any, would you like to comment on that, both on Rajasthan and UP then?
Yeah, so Rajasthan was something I thought of when Bhanu was speaking as well. So the Bhilwara model of containment and how they managed to contain the disease there is something that is now being looked at as one of the good, like a case study. And they seem to have done that, and they also seem to be responding in a more caring way, even when it comes to food distribution and so on. But definitely not as efficiently, because the system was not so much in place. But for instance, Rajasthan also is one of the states which has a bigger package that they've announced with not just rice and wheat, but also dal and ghee and other things in it. UP is a little difficult. Firstly, it's a very big state, and they've been making some of these announcements, but at the same time, we keep hearing also from civil society groups that much of this is not happening evenly everywhere, and there are many places where nothing is reaching. Also that these whole quarantine in the school is not always pleasant, that the kind of food they've been given, and that for them to stay there for 14 days. But it is true that the state announced these things, but at the same time, there are some very horror kind of stories also which come from UP, like where they were spraying this chemical spray on the migrants. They got them off the bus and sprayed on them and these kind of things were really, there is absolutely no dignity, or I mean, the caring part is missing. Also, UP, we are very concerned, and we don't know, particularly the Bundelkhand area, for example, where before the COVID, the last few months, there have been reports of starvation and so on. So what is happening there is not even coming out very much. So I would be very cautious about what's happening in UP. Also, given the current situation there, it's not easy for journalists to report either. There are very few who are doing that kind of ground reporting in UP.
Any other questions? Just looking at the data from today and over the past 2 weeks, it does seem that the growth in the number of cases is flattening a little bit, which would be, of course, really good news. The big concern, though, is that there's still very, very little testing taking place, and we may not really have a very good sense of just how many cases there are out there. Do you have any sense? I mean, I looked at the per capita numbers, and there's some variation across states, et cetera, but overall, I think it's 300 per million, which is still extremely low by any standards. Are you concerned that the rate of infection is actually much higher than what's being reported? I mean, Kerala's rate is better than most states, but it's still quite low. I assume because it's been a contained, focalized strategy. But you know, until we have more broad-based testing, do we really know how much the virus has spread?
Yeah, under-reporting probably not, but testing only now it is getting ramped up, basically because the testing equipment did not come. And something which has been disturbing in the last 2-3 days, though the cases are low, people who are quarantined 25 days back are showing symptoms. So asymptomatic persons, hidden coming up. I mean, all possibilities nobody is able to explain scientifically. So again, they are ramping up testing, both all these people, any sickness, and what they call pool testing and random. They're all trying to find out whether it is there. But one fear is, when you look at it, common sense fear, not from any science, probably in most states, it's all started by one person coming from. And so, and now much of it is due to the lockdown. Lockdown is really effective, even in parts of India where administration is not very effective. The moment you relax it totally, a lot of people are worried. And this situation also cannot continue with people starving and not having work. Yeah.
I would like to just add to that. I mean, like Mr. Janan said, testing is related to testing capacity, and that seems to be increasing. So there were these story that broke out yesterday and today in this website called Article 14, where they're talking about how the government knew that the lockdown would only be effective if they did a few things in preparedness. And there is, I think we need to start looking at those things more seriously, because the lockdown also cannot go on forever. There might be a limit to how much we can test. And have we really used, now it's been a month and we have another 10 days of national lockdown. Are we using these 40 days to prepare ourselves for a post-lockdown situation? And all the data that we have as of now shows that we haven't. And that is something that we really need to start doing, because if we continue the lockdown, it's very clear in this format where it's a national blanket kind of a lockdown, it's clear that the economic and social costs are very, very high. And we'll have to do that kind of cost benefit at some point. But more importantly, therefore, the sensible thing would be to, if the ICMR has told the government that these are the things they have to do during lockdown to be able to lift it, how much of it is done? Of what we know as on today, much of it has yet not been done. And that includes increasing testing also.
So, you know, in many ways, this pandemic is something of a natural experiment. You know, across the world, everyone's been deeply, suddenly, brutally impacted by this external force, as it were. And this is maybe a moment unlike any in the history of the social sciences, because we have a massive test of the capacity of governments, the capacity of societies to handle this cascading crisis. And we've heard a lot from you and learned a lot from you today about the different ways in which Delhi and Kerala have responded, both in terms of politics, but also institutions, and then accumulated trust among citizens and their willingness to comply with difficult circumstances. I guess the one follow-up question I have is, given what you're hearing in the media and social media from political parties and NGOs and in the public sphere, will there be lessons drawn from this? I mean, obviously there are some political efforts to communalize this. There's also been, I think, an increase in silencing voices that some politicians have exploited this moment of crisis to, threaten journalists, etc. What's your sense right now, given the current state of debate in India, of what, if any, larger lessons might be drawn from this crisis?
One is, a lot of people fear that this kind of war-like atmosphere could be translated for more depression and all that. But somehow I fear people, particularly the traditional Indian way of looking at things, they seem to have learned the lesson. So we need to change. I don't think it will be for the worse. It's very difficult for politicians to straight away. That's my optimistic thing. I have no evidence. But one thing, if it survives, not difficult to continue, is one of the only silver lining in the whole thing. People have learned hand washing and being not spitting, not sneezing. And everybody in India is now probably the whole 130 billion would have learned, crore would have learned. That if they practice 10%, it can bring down mortality. People have even given figures, TB, diarrheal diseases, and other contagious diseases. That's an optimistic possibility. But I don't anticipate having the suffering and healing spent up. Suddenly this can be used to bring again repression and bring back the divisive politics, and it's a little difficult because there is uncertainty is not coming to a clean end at a point in time.
Mm.
So nobody can boast because it may come back. That seems to be the way things are moving.
Yeah, I also can't, I don't know what will happen, but at least there is some hope that some things which was difficult to even say in mainstream newspapers to get space on, like the role of the government in provision of health, where we were going towards this entire insurance model and complete privatization, and that the government is inefficient. We feel that this has at least opened up spaces to say that when something like this happens, it's finally the public sector that has to respond and is responding in whatever way it is. So from the point of view of health in India and health provision in India, one of our hopes is that this brings back the centrality of primary health provision and the role of government in that. And the second also is all these social welfare programs and schemes that India has, which also keeps getting, again, in mainstream media, that they're wasteful and they don't reach and so on. That in the current kind of situation, it is those existing institutions and schemes and programs through which we are able to reach people. So even the small amounts that are reaching people is through the old age pensions, through the widow pensions, through the PDS, through the NREGA once it starts. So the value of all these kind of programs also, I think, or I hope, that the middle class and the general public also will see and understand, and there will be greater political support for these investments.
It's a fantastic comment. Thank you. Well, globally, I think one thing we can say for sure is that the handshake is now a norm of the past, and maybe more and more people will just say namaste and in solidarity, but also as part of a new global ethic. I want to thank Mr. Vijayanand and Dr. Sinha. This has been an absolutely fascinating conversation, and I want to thank all of you for participating. And I think Grace is still with us. Grace, thank you for organizing everything, and Ashu, thank you for sponsoring this series. Please do, I'll call on you, Ashu, but please do go to our website and share the link with those of you think might be interested in seeing this fantastic conversation. And I think Ashu may say something about this, but we're going to keep something like this going. Hopefully not for long, but it could be for quite some time. So Ashu, would you like to say something?
Yeah, it's precisely about keeping this going because we've learned so much in the last 4 weeks from our friends in India. The next Friday's seminar, one speaker has already agreed, and all of you perhaps know her, Shamika Ravi. Dr. Shamika Ravi in Delhi, who's become a one-person statistical army every morning.
Yeah.
Every morning, and enlightens us with her statistical precision. She will be joining us, and I think I'll organize a conversation. The conversation of hers. She's sitting in Delhi and generating these very, very important graphs and projections, and maybe someone from the ground level, from the field, in a conversation. But Shamika has agreed this morning, and that will be next Friday. If we schedule some more events, perhaps one more after that, we will, of course, announce it. And this particular video, as Patrick said, once edited for presentation, will be available to all of you. You can send it out, and will be, of course, the center will put it on, and Watson Institute will put it on our social media sites, and will be. I think this particular conversation will be very widely and very highly watched. Thank you very much. Dr. Sinha and Mr. Vijayan.